As soon as the vaccines started in Oregon, so did the social media posts. People excited to be getting vaccinated, posting pictures of themselves. Then came the emails from people asking why an OHSU marketing employee was getting the vaccine or an administrator at Providence. Viewers wrote us asking, "I just don't understand how people who are working from home have access to the vaccine before the true frontline workers or 30-somethings who are at no risk are getting vaccines while elderly, sick people wait and wait and wait." In a news conference this week, the Oregon Health Authority said what they thought was an isolated incident was more widespread.
We have become aware of vaccinators vaccinating staff going beyond the 1A category definitions.
OHA's Patrick Allen said that should not be happening.
Actually quite a bit more widespread. And so we're providing some very direct guidance out to vaccinators that we are still in category 1A and that we shouldn't be moving on to people who don't have patient exposure.
Federal guidelines adopted by the state of Oregon put people with direct contact with patients at the front of the line, but health systems were left to interpret the rules in their own way, and hospital systems were not hiding these vaccinations in any way. It was all part of OHSU's plan to vaccinate all employees in 6 waves. The employees in waves 1 to 5 had contact with patients. The employees in Wave 6 did not. OHSU started vaccinating Wave 6 on January 4th. Providence said they were following OHA guidelines from December 18th, pointing to a highlighted section stating healthcare personnel include but are not limited to EMS, nursing assistants, clerical, administrative, billing, and volunteer personnel. Providence said the administrator on social media had volunteered at a clinic for 8 hours at the end of December, welcoming and checking people in to be vaccinated. Legacy said they are only vaccinating patient-facing staff, not staff with outpatient contact. Kaiser said they are focused on frontline healthcare workers or first responders. And as for the VA Portland healthcare system, Director Garwin Goodspeed said they are vaccinating all employees and will continue with that plan.
Was the VA or is the VA giving the COVID vaccine to, employees who are not coming in contact with patients?
Yes, we are. The COVID vaccine is useless unless it's in someone's arm. So the vaccine sitting in a freezer doesn't help anyone. Many of our employees aren't direct patient facing, but they come into the hospital every single day.
The VA works closely with the OHA, but takes their cue from the federal government.
They're going to send out expanded guidance. Will the VA be changing the way they do things?
No, absolutely not. VA is following the guidance from VA. We partner with OHA very, very closely, but we're a federal entity. We respect their position and where they're going from a state perspective and figuring out how to cover as many people as they can. We have figured out how to get 80% of our patient-facing staff vaccinated.
And the Surgeon General, Dr. Jerome Adams, told NBC he feels states are actually too beholden to the guidelines, and states should be vaccinating as many people as possible.
So your headline today really should be Surgeon General tells states and governors to move quickly to other priority groups. If the demand isn't there in 1A, go to 1B and continue on down. And if the demand isn't there in one location, move those vaccines to another location.
Further proof, this entire vaccination process gets more muddled and confusing by the day.
Okay, Kristen Severance joining us now in studio. You can see how there is some outrage factor here. People waiting to get this vaccine feel like they need it, and then you have folks who are working from home who are getting it. But at the same time, we have federal officials and this demand from the public to get shots in people's arms.
Exactly. No one wants to see vaccines go to waste for any reason, but especially because the hospitals can't find people to vaccinate. I confirmed with Legacy Hospital today, they had to throw out 27 vials of the vaccine early on in the process because they said they could not find healthcare workers to vaccinate. So again, you don't want to see that happen. I think this story really shows just how all over the place this vaccination process really is.
Shows how important it is to have a plan.
Right.
Kristen, thank you.
You bet.